Thank you very much for your patience in waiting for this session number 5, Access to Information and the Opportunities for Innovation, Lessons from COVID-19. And in this session we'll explore how the COVID-19 pandemic brought attention to the need for policy developments, as well as looking at potential gaps and challenges that it may have created in freedom of information practice. Now, I know we're starting quite a bit behind time, so what we'll do is we'll miss out the introductions. I'm Dan Fitzhenry from Scotland, and then as we move forward, we'll introduce each panellist as we come to them with the questions. But we're really pleased to have a wide array of experience from across the world, from Taiwan, Israel, New Zealand, Kosovo, and Canada. And we've also got Uruguay helping with the rapporteur. So thank you very much indeed, everyone, for helping here. And we will just start by going to the first question, which is, in the face of the pandemic, are there identified gaps on or relating to the public's access to information? And if so, how did your institution employ innovation to counter these gaps? Now, 4 of our speakers are going to speak to this one. If I can start off with Caroline, please.
I'm going to do this here because with the little skirt sitting with the paper and the microphone, you know what can happen. So I'm going to do it standing up. So thank you everybody for being here. A very important subject, but like we were just talking about, aren't we tired to talk about COVID? So I'm going to be trying to give you a few practical examples of things that didn't go so well because of COVID in Canada, but things that actually were benefits that resulted from COVID. As you know, I'm francophone, so my English is not perfect, but it should be fine. So, first slide. If you want to please put the presentation. And for those of you who would like to have the presentation, I have all the notes in French and English that we can share with anybody. And second slide. So in March 2020, as cases of community transmission were confirmed, all of Canada's provinces and territories declared a state of emergency in Canada. So to varying degrees, provinces and territories implemented school closures, limits on gatherings, closure of non-essential businesses, and restrictions on entry. On March 16, 2020, the federal government started operating under alternative work arrangement. Basically, we were told, you're going home and don't come back to the office. Early in the pandemic, because of that, people thought, I don't have to answer access to information requests anymore. So I had to issue a declaration, a statement to all of Canadians and to all federal institutions that the pandemic did not suspend the right of access. And because ATI, access to information requests, were not deemed an essential service as part of business continuity plans in many institutions, the business areas, so the programs areas, were given all the tools, the online services, the bandwidth, but the poor ATIP units had no access to any tools for the first few months. So this is how we started 2020. The records were not being retrieved, the records were not accessible online, and the federal institutions did not have the tools to respond to access requests for a long time. So they were not meeting the legislative obligations, and some of them thought, like as I said, that they were optional. Next slide. So right away, we started with having some issues with infrastructure in the federal level. However, in my office, it created a great opportunity. Luckily, just before March 2020, I had decided that we were going to switch all our desktop for portable tablets, computers that people could take home and work from home. It was really a decision, had no idea that the pandemic was coming, but it saved us. Because on March 2020, everybody went home with their computer, and we still have not come back to the office after 3 years. So my office has done now online training, virtual meetings, where we hired over 35 new investigators from across the country, which we could not have done before because our country is really large and we were obliged to go to the office to do investigations. Now we can do this remotely. We have also implemented a provincial, federal, territorial training for investigation. So it brings in together 200 investigators across the country, and we do a conference like this one, virtually, where before people had to buy tickets and go to a province, and they would send 1 or 2 investigators to the conference. Now we are reaching out to all of the investigators of all these provinces. We put in place electronic signature, something that my legal services kept telling me, can't do that. You know, this is way too risky. And then all of a sudden, we're at home. So it worked. Changes makes what seemed impossible very possible. And now, who could live without electronic signature? We also started meeting our institutions during investigations virtually, where before we would demand that they would come to our office or we would have to go to their office, wasting time in traffic, wasting time, traveling. Now everything is done through virtual meetings. This meant that we are a lot more effective, efficient, and I will tell you more about that in 2 seconds if I can. Okay, so next slide. Unfortunately, while my office get great benefits from the COVID and working from home, some departments were not so lucky. One department in particular, Canadian Heritage, decided we're just going to stop responding to access requests, we're closing business, and we're not responding, we're not making any responses to access. So we had to do an investigation and force the department to reopen their unit. Some other departments did not have the tools, but they were very creative, and they used the phone to call requesters. And that department was National Defense, one of the departments that receives the most requests in Canada. And because they were all of a sudden talking to requesters on the phone, something's very low tech, not emails, they were able to resolve complaints and requests so easily. Talking to requesters, letting them know what's going on, the limitation, where the documents were, and if they could help them with some information, they could do it. So that was a great initiative from the National Defense. Immigration, Refugee, and Citizen Canada, who receives 200,000 requests a year, 200,000 requests a year, started using robots to perform the data entry functions requiring to register new requests. And that's something that they couldn't do before. All of a sudden, because they were working remotely, they got the technology and the money to do that. So it did provide some departments the opportunities. There were some missed opportunities, however. Next slide. I believe our government missed the opportunity to provide the information online to requesters. We were seeing still institutions sending responses to requests through CDs, through emails, when you really think in 2023, those access requests and the responses should be accessible through a database, which anecdotally, there's a journalist that started a database in Canada, and he's taking all the access requests through Canada, provinces, territory, and he's building a database of the responses. And he's doing basically what the government should be doing, which kudos to Globe and Mail, by the way. The one thing also that there was a missed opportunity is the declassification of sensitive information. We don't have in Canada a program that declassify information. So basically, for 2 years when we were working from home, all of the information that was top secret and secret were not treated, were not retrieved, and were not giving access to. So that was a missed opportunity in my view. Last slide, please. At the end of the day, COVID made a already exacerbated system way worse. The backlogs grew, and COVID nowadays is still used to delay access requests, which is unfortunately, and it did result in 185% more complaints to my office. So last year we received over 7,000 requests for appeals and reviews. However, my office, because we're now working remotely, we have become so much more efficient, and we were able to close 8,000 cases last year, which is an increase of 310% since pre-COVID. So, unfortunately, well, you know, there's an ability to use and to adapt to changes, and we did that, but some of the institutions in government just didn't follow through. Thank you.
Thank you very much for that, Caroline. I'm now moving to see the Israeli perspective of could I invite Chloe
Can I speak from here, although I don't have a skirt? Thank you. Thank you for your patience. When I'm asked about gaps in information with the outbreak of the pandemic, I think that all countries, and Israel is no different in this sense, first and foremost experienced themselves as decision makers gaps in information regarding the pandemic and its characteristics. And of course, the entire population did as well. This fact only increased, of course, the fear and insecurity of the population, which also translated into suspicion of the restrictive measures taken by the government, which only increased as the measures intensified. In terms of the right to information, on the one hand, we naturally experienced a sharp increase in the number of requests for information submitted to the Ministry of Health in connection with the pandemic. And on the other hand, all the employees, as he said, of the Ministry of Health, almost without exception, were recruited for the benefit of dealing with the pandemic and were not free to deal with the public's right for information. It was a real conflict. In other ministries, most of the employees were released, sometimes even the freedom of information officers themselves, and there was no one to respond to requests for information. We, as the Freedom of Information Unit, also experienced a sharp reduction in the number of employees, and our ability to perform our duties was restricted. The fact that the unit was not considered exceptional and as such must be fully staffed shows that decision makers are not sufficiently aware of the importance of the right to information during a crisis and its role in strengthening public trust. This is already the first lesson that needs to be drawn for the future. As I said, the Ministry of Health was unable to meet the demand for information through requests for information. However, at the same time, it began to proactively publish information on the so-called dashboard. The dashboard is actually a dashboard of statistical data that evolved over time and included more and more data relevant to the pandemic that the Ministry of Health held, such as the number of infected, vaccinations, deaths, ages, gender, and much more. The dashboard was updated 3 times a day and became the main tool used by the media, researchers, and the public as a whole. The public could make use of the graphs themselves or download the files on which they were based and use them as they pleased. I would like to focus on the meaning of the dashboard, as I see it as teaching us an innovative lesson for the future. Before that, I would like to note and point out that we, as a unit, led the process of awarding the Minister of Justice's Transparency Award, a process that is carried out once every 2 years, to the IT unit of the Ministry of Health that was responsible for publishing and maintaining the dashboard and the corona data. The award was given in May 22, while the peak of the pandemic was already behind us. In doing so, we wanted as a unit to express our appreciation to civil servants who were engaged in promoting an agenda that is very important to us, namely the agenda of proactive information publication. Despite our hopes, winning the prize received almost no media coverage, and on the other hand, drew hundreds of comments of ridicule and disbelief on Facebook where the win was announced. And there I come to the main point. It is common to say that transparency increases public trust in the authorities. However, studies show that transparency alone is not enough to do this, and that in order for transparency to increase public trust, the public must ascribe good intentions to the authority and believe in its professional ability, while the authority must express, along with the transparency, a willingness to correct deficiencies if they are discovered. Did the publication of the dashboard by the Ministry of Health strengthen the public's trust in the Ministry of Health? Judging by the criteria I mentioned above, the answer is questionable. At least some of the elements I mentioned were missing, some of which were the ministry's fault, and some not. We actually experienced polarization among the people, lack of trust in the authorities, much criticism of the restrictions imposed on the public, and I do not express an opinion whether rightly or wrongly, and many conspiracy theories that popped up like mushrooms after the rain. So is the conclusion, therefore, that publication of the dashboard and all the accompanying data was a meaningless step and perhaps even harmful? Absolutely not. The answer is that you have to look at it in different eyes. First, if the data had not been published, it would have been simply an unacceptable step, which would have met with enormous public pressure and criticism, and rightly so. The fact that the Ministry of Health understood this in advance and published the data and also went on in refining it is a great achievement of the value of transparency. Second, we need to look at the value of publishing in terms of accessibility to knowledge. As I said above, this data was used by many external bodies for the purpose of conducting research and building models for predicting the pandemic. If we accept the assumption that ever-increasing professional bodies engaged in data analysis and an active academic discourse improve the chances that a better decision will be made, it is clear that publishing the dashboard is very valuable as it increased the possibility that decisions were based on correct models. Third, the publication of the data encouraged an active public discourse. It is true that a significant part of the discourse was irrational, divisive, and even violent. Nevertheless, this is the essence of democracy. I would rather bear these prices than live in a country where it is forbidden to express an opinion at all. It is true, however, that violent discourse and conflict are a big problem that needs to be thought carefully about how to handle without compromising, of course, the right to expression and information. From conclusion, as a governmental unit for freedom of information, and this is the innovative point for me, the corona has greatly strengthened our recognition of the importance of proactive information publication, an agenda that we promote in the public authorities. At the same time, the coronavirus taught us that the connection between public trust and transparency is complex and depends on additional elements. Hence, the value of transparency needs to be understood in more holistic terms if we want to achieve one of its most important goals, strengthening public trust. Indeed, in a world suffering from polarization that is getting worse and worse, I believe that one of our most important roles as Freedom of Information Commissioners is to understand in depth how transparency strengthens the public's trust in the authorities and to impart this knowledge to the public authorities. Thank you very much.
Thank you very much for that fascinating insight into public trust during the pandemic. Moving on now to the Taiwanese experience, could I ask Chuang Min Fen for her views on this matter, please?
Okay, I think you can hear my voice. Okay, can you? Okay, okay. I prepared some slides so you can see the screen. As a public servant, I was always thinking, what did Taiwan do different from other countries. So today I would like to raise two practical experiences share with you. First is data governance, and the other thing is about digital service delivery. Okay, 10 years ago, go next page. Next page, please. Okay, 10 years ago, Taiwan launched Open Data Action Plan. And in the beginning, government agencies were unfamiliar with open data. They started by opening 5 data sets only. However, as of today, there are over 56,000 data sets available on the platform, with page views pacing 119 million and more than 19 million downloads. Agents now, they are very familiar with deal with the open data, so they provide multiple high-value data on weather forecasting, air quality, actual price registration of real estate transactions. So those data can be used by the private sector and the industries. Next page. So the first case is about real estate price reference. Government opened data on real estate prices. Private real estate agencies and service providers developed a number of applications using those data to prevent prices jacked up and gradually realize the housing justice. Next page. And the other case is about face mask map. Okay, when the pandemic spread, in the beginning, Taiwan was facing a serious face mask shortage. So at that time, ensure everyone in Taiwan could buy face mask. The National Health Insurance Administration made public the addresses of all pharmacies and the data on their face mask inventory, with that information updated at 30-second intervals. So as a result, everyone could access open data on the number of masks at the pharmacies. On the basis of the open data, GovZero and participating civic groups established more than 130 tools. So anyone needed to buy face masks, whether those who like to use the map, those who like to hear voices from the virtual assistant, or those who like to use the chatbots, they can use the same. They can access the same information and check the location of the nearest pharmacies with the available mask. So this kind of action established a uniquely Taiwanese form of public-private collaboration to combat the pandemic, which also attracted a lot of international attention. Next page. So in Taiwan, we think we have a special situation because Taiwan has passionate and influential communities. So that's why we, after the pandemic, we continue to hold presidential hackathon. Through the presidential hackathon, we can collect smart ideas to improve the government governance. So you can see every year we can select five winners, and their proposal of winners should be implemented by the public sectors. We would like to make their POC reality. Okay, next page. So the second practical experience, I would like to show you how we deliver the relief subsidies. Okay, I think many governments in many countries have launched a lot of relief packages. In Taiwan, the Executive Yuan set up 1988 Relief and Stimulus website to collectively list all relief packages and subsidies across functions so that the public enterprise, labor, disabled, can check this information and to find appropriate subsidy to keep their basic living and minimum the COVID effect. However, that's the citizen demand. But on the government demand, in Taiwan, most ministry use big data analysis tool to find the affected peoples and directly remitted the cash relief to their bank account in 3 days once they were qualified. So the efficiency is very enough. Okay. So next page. But after the pandemic, we are always thinking, is it a good way? Can we have a better way to solve this service delivery? Because you can think one thing. During pandemic, each ministry built up or modify their information systems to respectively to support the urgent needs. After the difficult times, we figure it's more efficient way, that is to integrate relative resources from each ministry to build up a shared platform. All future relief packages, including cash subsidies and living supplies, will be handled through common platforms, which can show the administrative efficiency. So it's important to build up data exchange among governments in a secured infrastructure. Okay, so as the ministers talk, she always say that let technology be shared instead of being exclusive, so that the next step we will adopt the spirit of public code, which leads a better transparency, accountability, and innovation in the public sector. Thank you.
Thank you very much indeed for that insight into how the publication of data was used to help responses to the pandemic itself. Moving on now to Peter Boscher with the New Zealand experience, please. Thank you.
Thank you very much. I most want, at this late stage of the day, you to feel that my 5 minutes are interesting. So we're going to do a bit of a discourse on what we did on access to information during COVID. This session, the focus is the various adaptive and innovative practices to advance the right to information amidst uncertainty of our time. So it's about innovation, what we did differently and what we might do differently for the future. Next slide. Just a little bit about me and our country. It's a country of 5 million. It's about as far away as you can get. And in New Zealand, the Ombudsman, which I am, I'm also the Information Commissioner. So it's a combined role. That's quite handy because we can use the powers under each side to make the job a little bit easier. And you'll see it's quite a widespread role here, including monitoring and receiving protected disclosures. So in all of this, it's a broad job. The next slide. Well, as some of my colleagues have commented, and you, Caroline, we went into lockdown on the 25th of March, 2020. And what happened over that made it different and interesting? A couple of things. The first is that I had a prior briefing as an integrity agency head from the Prime Minister's office. This is what you should expect. This is what's going to happen. So I wasn't taken by surprise. I felt that we were ready. And you know, often in crises, we're not ready. Well, sometimes we can't be in the case of major earthquakes. But I felt that we had gone out of our way to get ready. And the third thing, and again my colleagues are commenting on this, that readiness meant that when lockdown occurred, virtually all of my staff went home and were able to work by remote in a secure setting from devices. And I think had we not done that, we would have got into all sorts of delay issues. The next slide. What I asked our government to do was to make me an essential service. So a lot of this will resonate with you. During times of crisis, all sorts of things are circumscribed, and only some things were allowed to operate in public, and here they are. But some of us went to the government and said, look, an integrity agency such as the right to information should be right up there with the police, the army and everything else. And we had no trouble in being designated as an essential service. The next slide. I think the thing I want to talk about as an integrity agency is that balance. What do you do as an information commissioner when on the one hand your country is in lockdown facing a crisis and on the other you've got to keep democracy going? You know, it's during a time when many coercive powers are used that the public most needs to know, I think, what is being done and why. So the next slide just shows you the things that my office decided that we would have as principles in a time of crisis. Transparency, accountability, openness, fairness, but then these things, sympathy, honour, mana, which is a Māori word for strength and pride, dignity of the person. And we made it clear publicly that we would go with the government and understand the need to be coercive, but we wanted people's honour and their integrity to be preserved. So let's just go to the next slide. This is our Prime Minister who gave every day a briefing at 1 o'clock, and the person next to her is the Director General of Health. And it really made the point to me that if you are telling people the number of deaths occurring, the number of new cases, what the government had decided to do that day, the people by and large trusted the government and would do as they were told. And I think it opened the door on the fact that transparency breeds trust and people will follow the lead. The next slide. So my office decided that we too needed to be innovative. We needed to be, I'll call, agile. So we updated our website to give people fresh, brand new information on what they could expect during a pandemic. The next thing we did is we put guides on, we made it clear to agencies that although we were in a crisis, they had to still perform. The next thing we did is we asked agencies to triage complaints. If something was minimal and it didn't much matter, we asked them to drop it to the bottom of the queue. But if it was something really important and it needed to be dealt with straight away, we asked them to triage it, not just put it in a pipeline and when it would be got whenever they managed to get to it. So we asked them to look at everything by way of a request when it came in and classify it as to how important it was. And the last thing I just wanted to say about this, sorry, just go back one. The use of social media is something we had not done much before. And as this session is about innovation, we decided that we needed to be out there, we needed to tell people what was happening each week, and we asked agencies giving out information to publish on Monday of each week proactively what they'd done in the last week and what they were going to do in the week in which they were in. And there really hadn't been too much emphasis on this, but we didn't want to be submerged in complaints because people didn't know what was happening. And so with the use of social media and people proactively publishing, we found that the flow of information worked well. Now we're just about through. The next slide, thank you. Just as an example of something that people wanted to know about, your countries might have been the same. If you came back into New Zealand during the lockdown period and afterwards, you had to go into a managed isolation and quarantine facility. And people didn't know what to expect. They were worried, anxious, didn't have the money. And so a lot of our information was out there saying to people each week, this is what we've decided needs to be broadcast. this is how it works, and this is what's reasonable, and this is what is not. And the last slide. So that's our approach. What did this produce by way of innovation? About three things. One, confidence that transparency works. And I think in a way that people hadn't realised before. Secondly, to always be ready and be ready to move straight away. And the third thing was brand new ways of operating that I would never have imagined would have been possible when I started this job at the end of 2015. So thank you, that's us.
Thank you very much indeed for that, Peter. Now, moving on to Sibel Brazil, please, for your experience, please.
Thank you. Good afternoon, everyone. My name is Sibel Brazil. I am from Brazil. I work at the Office of the Comptroller General. Next slide, please. The Office of the Comptroller General is the central body for monitoring and oversight the application of the law on access to information in Brazil. We call it LAI. The law is for all, for the federal level and state level and municipalities, but the CGU is only responsible for monitoring and oversight the federal executive branch. We are also the administrative instance of appealing of complaints on access to information denials. We also can apply administrative sanctions to public officials who does not comply with the law. And we provide trainings and orientation on the implementation of the law on access to information. Next slide, please. Okay, so in a different way that if we compare with Canada, the Brazil situation was kind of different. We had a challenge on the right to information during the COVID pandemic. Our government, I mean the former president of Brazil, he just put a decree, a presidential decree, suspending the appealing process on denial of information requests, and also suspending the deadlines to answer, to respond to requests for information that were sent to public bodies implementing or fighting corruption. I mean, Ministry of Health and every public body involved in fighting corruption should not keep how can I say, keep the timeline in Brazil. We need to respond to requests for information in 20 days. And he suspended everything. So it was, the law was at risk. The implementation of the law was at risk. And our law nowadays has 11-year-old. Thank you. There was a strong reaction from society when this decree, this presidential decree was published. And then the restrictions, all the restrictions that were sanctioned by the president were suspended by the Supreme Court 2 months after this, due to the press, how can I say, the pressure from the press, from civil society, and it was a good way to understand that the transparency and access to information was not going to, how can I say, be affected, because society was trying to defend it, and it was a good response from society and from the Supreme Court. Next slide, please. So CGU, by that time, we had 2 months in which the appealing process was suspended, and also that some bodies could not comply with the law requirements. So that what did we do at CGU to reduce the impacts on it? I need to tell you that at Brazil, since the day one of our law, we published a unified system to register requests of information. This unified system is used for all executive federal in the federal branch, all executive public bodies. I'm talking about 312 public bodies, and all the requests are done by these two, through these two. And even with these two, there was the suspension of the appealing process and the requests, but the country, I mean, we had the infrastructure, IT technology and infrastructure to keep answering access to information because everything is on internet and available to everyone. Okay, but CGU, we are responsible for monitoring the implementation of the law. We started to publish online weekly reports informing about delays to respond to requests of information, especially those related with the COVID-19 topics or subjects. Also, since we're doing these weekly reports based on data recollected through the system, we established a close and systematic contact with the bodies that were obliged to enforce the compliance with the law. So we started, if we saw that Ministry of Health, for example, was delaying in the response of information, we called them, we set up meetings, online meetings, and we tried to force them to get to the request and respond it properly. Next, please. Besides that, the Ministry of Health, Brazil has gone through other, not a pandemic, but sanitary emergency when we talked about H1N1 influenza pandemic from 2009 and 2010. So we already had technology to get information on provided by the 27 health secretariats, send data to the Ministry of Health that had this technology to compile all this data and publish it on open data. We got daily updates. This previous experience helped a lot when we faced the COVID, because we had the infrastructure to receive those data, and those data were already prepared with predefined format to sending files and things like that. So using this data, the Ministry of Health published an online dashboard to track the cases and deaths confirmed on due to the COVID. Next, please. I also brought here this experience that was a data collaboration with the private sector. It's called the social isolation map. I'm not quite sure if this translator is correct. I'm talking about tracking if people were staying at home and not going to meet other people. So the companies, the mobile phone companies, just started sharing data. Geolocalization data were provided by those companies. Obviously, anonymous data, and they were presented aggregately, so that the government, the local governments and local states could check if the social isolation was really functioning and take actions to, how can I say, if it was not being okay in some regions, they could take actions to sort that out. 14 states out of the 27 states in Brazil used this app that was developed by a startup to monitor this social isolation. And we got data from the biggest mobile phone companies in Brazil, Vivo, Claro, and TIM. And it was possible to try to help fight COVID. By that time, it was really important, an important tool. It's important to tell you that by that time, this solution was also offered to the federal government, but they declined it. The states used the solution, but the federal government declined to use the solution as well. Next slide, please. And also, I saw that this was something that we also should try to share here, is the necessary transparency of budget and expenditure to fight COVID. Everyone knows that the relief package and the amount of money that every country needed to put in order to fight COVID. In Brazil, we are talking about $100 billion if we accumulate the investment and the expenditure since 2020. Also, due to the emergency, the sanitary emergency, the bidding and the acquisition procedures were simplified. And because of these, please next, the expenditures should be subjected to public scrutiny. Brazil has the Brazilian Transparency Portal that was created in 2004 by CGU, our company, and we publish data on budget, expenditures, revenues, bidding process, contracts, users of government credit card, social assistance provided to citizens, and many other subjects with daily updates. In Brazil, we have this central system for all payments that the government does. All those 312 entities use the same systems. It's a centralized system. For that reason, at CGU, we can get information on daily updates and tell today what the government spent yesterday, every day. So it's a good practice that people can track expenditures, contracts, and everything else, and how the public resources are being used. Next, please. So we had the data, but we needed to provide some specific queries, some specific ways to find the data in the portal. So we launched specific queries on expenditures to fight COVID, the vaccines acquisition, and also the list of people who received emergency assistance, who were awarded with the emergency assistance. It may seem strange because everywhere that we say that in Brazil, we publish the list of people, naming them, who get assistance from government. People think it's strange, but actually, by the time we started publishing those data, we were able to prevent corruption and even to encounter corruption case. People who were not supposed to get those assistance were receiving. And when we opened it, when we published it, we saw that like mayors' sons who received the assistance, and deputies and people related to rich people that were receiving the assistance. And this was a way to fight corruption using an important resource that should be allocated to people who were needing that resource by that time. Next, please. That's it. Thank you.
Thank you very much indeed for that explanation of a very different set of challenges and how it's met by open updates and proactive regulation. Moving now to our final question, with a looking forward, really, to how some of the lessons that we've learned can be utilised. Can I ask how these advancements in policy and technology that we've seen from the pandemic can lead to a more inclusive ATI practice? And can I ask that of Crinara Dermarcu from Kosovo, please?
Thank you so much. Yeah, being the last panelist in those late hours, it's not really easy, but I'm going to keep it very short. Yeah, in fact, the pandemic has learned us a lot, and especially the development of the technology has been reached out in very, very fast way. And this helped all the countries on, in fact, take the attention of all the professionals, IT professionals, to develop these platforms and all those applications, IT applications, to make our life easier as citizens and to get the information much more faster than it was before. One of the very important tool, if I may say, that has been imposed in my country at least, and in a lot of countries, at least in the region, is the digitalization of platform of public services. We call it as an EcoSova, and this is the application of the ability to access the government services remotely. It means that all the services, public services, are gathering in one application, and all the citizens can have access and being informed about everything regarding register, civil register, property rights, and so on. And in general, this platform also gives the information to citizens for all the data that should citizens has been known through or have been known before through the other means and tools in place. The other important tool, if I may say, for after the pandemic on digitalization development, it was also the data visualization and infographics. Government and the other public institutions are using today a lot of infographics to give the information to the public regarding the annual reports or budget lines and expenditures or all other information. And this is, how to say, briefly platform to offer to the citizen for the job and for the transparency of the government and public institution in general. Raising the accountability and transparency is also the application or one step towards to the development of the technology that they used. It was the video messaging addresses. A lot of our political and also a lot of public institutions are using those addressing messages for the citizens. That is, in one way, is very important and very innovative and very close to the citizens to give the information, but in another hand also creates this gaps between citizens and government when they have to ask something more in details, for example. But it's good that now in Kosovo we have set up already, based in a new law, that the strength of the independent agency who's taking care for all the requests of the citizens towards the information and access to public documents is also one mechanism that is imposing the fines. And now the institution cannot easily, how to say, escape from their own responsibilities to inform the citizens. Yeah, in general, if I may say, the technology development has been fostered on pandemic, even using those social platforms. We in Kosovo, we are using a lot social platforms to spread the news. Also, this is based even from the public institution, even from the private institution, and especially the civil society is doing a lot on this. In general, the pandemic has, from the pandemic, we learned a lot regarding the development of technology that also have a big results on information and access to public document. All those platforms that are used on a proper way to, and in fact are developing each day to reach out all the citizens with the news, but also making more responsibility and accountability all the public institution, because people now are much more indeed ready and faster to get all the information. So this is in general, and I want to keep here because of the time, so thank you.
Thank you very much indeed for that, and thank you to all my panelists for putting so much information into just under an hour, which I hope will be appreciated by everybody. I'll not now ruin it by blabbing on. I would just like to thank them all again, and to thank also Dr. Paula Saravia for being our rapporteur today. And thank you all for listening, and to close this session. Thank you very much indeed.